Hello, and welcome to the training video for the Early Screening Inventory, also known as the EZR. The EZR has been adopted by the Wexford-Missaukee ISD Early Childhood Leadership Team to meet the requirements of the GSRP and Head Start legislation for a common screening tool. It is to be used by all preschools in the Wexford-Missaukee ISD area. Local superintendents, NEMCSA and NEMCA have approved this tool. The EZR is designed to identify children who may need further evaluation to determine if they have a condition that may place them at risk for school failure. It should be used only to identify the possibility of a condition that might affect a child's overall potential for success in school. The EZR is a screening tool. It is not a readiness test. Results from the EZR show skills that children have acquired. High-stakes decisions should not be made as a result of this screening. Screening tools may be misused in some of the following ways. Sometimes they are used as school entrance or readiness tests. This should not happen. It is not what a screener is designed to do. A screener should not diagnose a child or be used as an IQ type test. Children should not be labeled based on a screener. Sometimes screeners are insensitive to bilingualism and other cultural differences. Sometimes screeners may cause a child to be isolated from a follow-up evaluation and intervention. There are differences between screening tools and assessment tools. The EZR is a screening tool. A screening tool is used to identify children that may need further assessment to determine if they are at risk for school failure. It is not used to determine a disability. More in-depth assessment tools would be used for that purpose. It is also not a progress monitoring tool. The GOLD and other tools will be used to measure progress over time. There are two available protocols to use with the EZR. One is the preschool form, which is used for children from 3 years 0 months through those 4 years 5 months, or the kindergarten form to be used with children who are 4 years 6 months through 5 years 11 months. There is also a parent questionnaire, which is optional but may give very helpful information. When preparing to screen, it is important to have both protocols available, since some children may enter preschool already over 4 years and 5 months. Please make sure you have the manual with you as you prepare to screen your students. The manual gives helpful information on scoring. It gives examples to which to refer, and it gives you a script to use while screening the child. Protocols can be ordered from the Pearson Company. You will see their phone number and a link with which to go to order the protocols. The Pearson website looks like this. You will need to know the child's chronological age at the date of screening in order to determine which protocol to use and also to use on the scoring chart. There are two ways to do this. You can go to an online age calculator and it will do the work for you, or you can do it manually. If you click on the link shown on the screen, prior screen, it will bring this, the chronological age calculator, up. All you need to do is simply go to the name and put in the name of the child, and then you put in their birth date. For example, Susie Q was born on May 21, 2014. It automatically puts today's date in. Simply click Calculate Age and it tells you Susie Q is 4 years, 1 month, and 20 days. This will guide you and choosing the correct protocol to use with Susie. We can also calculate age manually. You just need to remember to, when you're borrowing, reduce the month column by 1 and add 30 to the days column when you're borrowing for days. And if you're borrowing for the month, reduce the year by 1 and add 12 to the months. Here is an example. Here's the example. Let's say that the child's birth date is May 21 of 2014 and today's date is July 11 of 2018. Now when you write it down on paper, you have to start with the year. So you'll write today's date as 18/7/11 and you'll write the child's birthday as 14/5 being the month and 21 being the day. And now it's time to subtract. Since you can't subtract 11 from 21, we need to borrow from the month column. So we cross out the month and reduce it by 1, making it go from 7 to 6. Now here's where the borrowing comes in. We base a month's borrow on 30 days. So we have to add 30 to our 11, making that 41. So then we can subtract 41 minus 21 is 20. So now we are left with 6 months, and which we need to subtract 5 from. So 6 minus 5 is 1. And then 18 minus 14 is 4. So the child is 4 years, 1 month, and 20 days. You may need to round a child's age. If the number of days in the current age is 16 days or higher, then round up the month to the next higher month. So if the child was 4 years, 3 months, and 18 days, you would round it up to 4 years, 4 months as the chronological age. And then use that to determine which protocol to use. If the rounded age is between 3 years and 4 years, 5 months, use the preschool form. If the rounded age is between 4 years, 6 months and 5 years, 11 months, use the kindergarten form. To become familiar with the administration of the ESI, watch the training videos. They give examples of how to administer this to a child. Again, it is important to have your manual at hand. Follow the script that is given in the manual. Follow the directions exactly. For example, when they tell you to use a screen when building a model of a block structure, do that so that the child cannot see what you are building. Or if it tells you to place the cards for the visual sequential memory in a certain order and a certain way, that is exactly how you must do it. The manual is very helpful, and the ESI should not be administered without the manual. It's a good idea to practice with the script and materials. Grab one of your own kids, a spouse, a friend, a neighbor, and administer the ESI to them. The more you become comfortable with it, the easier it will be to do. Again, the script must be followed verbatim, and refer to that manual for scoring also, especially when you are doing the copy forms section, as it gives examples of what is acceptable to give a score or what needs to be scored as a fail. After the screenings are completed, results should be shared with parents in person, by phone, and or in writing. After completing the ESI for each student, the results are to be sent in a class composite chart to the coach, the early childhood specialist, your supervisor, and the Wexford Missaukee ISD Early Childhood Special Education Office at this email that you see here. The composite form looks like this. You fill in each child's name or some other identifying factor there, and their enrollment date, their date of birth, the date of the EZR parent questionnaire if you've done that, the date of the screening, and then in this column you mark whether they scored okay, rescreen, refer, or refused. In this column, indicate whether you used the preschool form or the kindergarten form and what score was given at the end. If a rescreen is given at a later date, you may put that score here. Some programs will be using the Denver and the Brigant screener, and if that is the case, then you can put the date and the scores here. The Denver or Brigants will be scored with pass, fail, refuse, or could not test. You will need to download that composite form and type in the form fields. And for your name, example, put in Mary Smith 2018 EZR Composite to title it and save it in that way. Email this completed composite to the appropriate personnel. If you would like to share the results in writing in addition to speaking to them in person, there is a sample letter that you could use that looks like this. It just tells parents a little bit about a screening and what it looks at, and then here you would put in the child's score, and the table below here shows the categories, as parents may not be familiar with that. So scroll down here. It has a table that they can refer to for their child's age and the score number they've been given. It might be helpful if you send a form like this home that you would highlight whichever age category the child is in, so that the parents may be more easy to understand what score they have received. This letter tells the parents that if the child scored in refer or rescreen range, supports will be provided. It also reassures parents that developmental skills are gained often by simply being in a high-quality preschool where there are social and language interactions, participation in large and small groups, structured routines, and a play-based learning environment. There is a link to this draft or sample letter on your screen. The EZR class composite is useful for you in that you may look at the data and use that to differentiate instruction for students who have scored a rescreen or a refer. You can use that information to develop large and small group or individual activities to increase skills and competence in an area. Contact your coach for support to develop intervention strategies. Other information that will be helpful to collect would be information from parents and healthcare providers, the EZ parent questionnaire, and other health screening information. Always observe the children with the goal objectives in mind and take anecdotal notes. The Next Steps document is a valuable document that gives steps to take to provide the children who scored rescreen or refer with the support they may need to be successful in preschool. Read this linked document. It contains very valuable information on procedure. I will summarize some of it here, but do refer to the document often. It's helpful to download it and print it for reference. Up here it tells you the reason for developmental screening, and then it talks about those that score refer or rescreen and how we need more information on those children. This is really important to note, where it says the first intervention is always the preschool classroom and exposure to the general education curriculum. Children will benefit from Tier 1 strategies, which include high-quality instruction, consistent routines, peer interactions with a general education preschool setting, and Tier 2 strategies for individualized instruction when appropriate. During this time, it's important that you gather information, which might be consultation with your coach for classroom support, observations based on the goal assessment, work samples, data regarding a specific concern, parent input, and input from healthcare providers, including hearing tests, vision tests, physicians' reports when appropriate. If needed, you may establish contact with a therapist or preschool teacher consultant assigned to your classroom to determine immediate needs of the child. The ISD preschool office is available at this number for support. Just remember that the professional discretion of the ISD staff takes precedence over this document. Students who initially score a refer or rescreen will need further consideration. Consult with your coach regarding the child's growth, which you are monitoring over time. But if you still have concerns, then further investigation is warranted. The ISD preschool teacher consultant and the teacher will review the information and may decide to conduct a child study meeting to discuss the concerns and problem solve with a preschool team, which could include classroom staff, ISD staff, coaches, and parents. Some recommendations that may be based on that meeting could be specific data collection, strategies, accommodations, or special materials, the DECA, monitoring progress for a specified period of time, or it could be referral for testing and possible special education services. If a child has behavioral challenges in your classroom that have not improved with Tier 1 and 2 strategies, follow your local program procedures. If you have a student who is currently on an IEP but presents additional concerns, the teacher and or the ISD staff must contact the preschool teacher consultant, who will review data and schedule a child study meeting. Invitations to this meeting will include classroom staff, coach, ISD staff, parents, and others as needed. So there's the next steps document in a nutshell. It was developed by the early leadership team of the Wexford-Missaukee Intermediate School District, and it was revised December of 2017 by the multi-tier system of support team. And it's supported by the following agencies and schools: CAPS, NEMCA, NEMSCA, WMISD, the YMCA. Now that you've viewed this training video, it's time to view the other training videos that are linked on this page. After watching those training videos, take the quiz. You will be emailed a certificate upon completion. Thank you for participating in this training. We hope it was helpful. Please feel free to call or email us if you have a question about this or you would like support in your screening process. We wish you all a wonderful school year.